Am I up?
Hi, everybody, and welcome to our April ambassador briefing. Today, we are going to be joined by Holly Bodie, our Vice President of Government Affairs, and she will give an update on everything going on Capitol Hill. And then I will speak about our various advocacy opportunities that folks will have throughout the year. And then we'll have our regular Q&A time. So without further ado, I will turn it over to Holly.
Thanks, Ben. Hi, everybody. I know I've met probably most of you, so nice to see you again. Thanks for joining, and those who I haven't met, nice to meet you. So like Ben said, I'm just going to talk about what's going on Capitol Hill, and I'll also do a quick review of kind of what is happening within the administration. So I'll start with the Hill. Next week, when Congress has been out of session this week and last for the Easter Passover recess, but they're back next week. And we expect that the Living Donor Protection Act, which is legislation that's been introduced in every Congress for the past 7 or 8 years, will be reintroduced on April 29th or 30th in the House and the Senate, and it's bipartisan legislation. So we're excited that that will be reintroduced again. Last year, we had about 150 co-sponsors in the House. So we have a high bar to meet for this Congress, but we're happy that that bill has been introduced. So as far as kidney policy directly, that's the main thing that's going to be happening on the Hill. But May is also the month that the committees in the House and the Senate will be looking at Medicaid. And the budget making process is somewhat complicated and complex, but to distill it, I think, down to its basic principles, the House has to find the House Energy and Commerce Committee, which is one of the biggest committees in the House. One of its primary areas of its primary programs that it sort of has oversight over, the Energy and Commerce Committee, is Medicaid. And Medicaid, as you all know, is the program that is aimed at low-income people. It's in all 50 states, but each state, administers it a little bit differently, but it's at least funded. Half of the funding, at least in each state, comes from the federal government. And so I think there's 30 or 40 million people on Medicaid, maybe probably more than that. So it's a lot of people, and so it's a very expensive program. So Congress right now is looking at, as many people probably know, they're talking about, extending the tax cuts that were passed in the previous Trump administration. And in order to do those tax cuts, they have to find savings in other areas of the government. And so one of the programs that especially House Republicans, not so much Senate Republicans, have focused on is cutting Medicaid. So next month, May 7th to be precise, the Energy and Commerce Committee will be looking at the Medicaid program and deciding how much to, oh, I'm sorry, I was completely off. It's almost 80 million people in Medicaid. Wow. So I was completely off on my number. So it's a lot of people. They're going to decide, at least starting on the 7th of May, what should be cut in the Medicaid program. The original target that the House was looking at was 800 billion. So that's 800 with a B billion. Those kind of cuts in Medicaid would be devastating to the program, and it would require a lot of deep, deep cuts. About 45% of people who are on dialysis they're on Medicare and Medicaid. They're called dual eligibles. So there are a lot of people who are on dialysis who also have Medicaid. And of course, Medicaid is important for treating kidney disease in its earlier stages and also for preventing the onset of kidney disease. If you have good health care, you're, perhaps less likely to develop kidney disease in the first place. So we have been very active up on the Hill talking to members, especially Republican members, about how devastating these cuts can be. We actually, have numbers of the number of Medicaid recipients in every congressional district. And so we have been having these conversations, and some of the offices have been certainly open and interested and are all share our concerns on the Republican side for these cuts. So anyway, this process sort of starts in earnest early in May when the committee starts looking at how they're going to cut Medicaid. What they do is not the final word. The House, or excuse me, the Senate also has to approve these numbers. And the Senate's numbers for targeted cuts are about 1/4 of what the House cuts were, the cuts that the House suggests. So this is just the first step in a process, but just wanted to make everyone aware that this is going to be happening next month. And I know you've probably already gotten emails from us, but if anyone on this call or anyone that has is on Medicaid and can talk about how important it is to you and in your health care journey, we would love to hear your stories. And then I'll just quickly pivot to the administration. The dust, as they say, is still settling a little bit at the Department of Health and Human Services. That's the primary department we work with. That's where Medicare and Medicaid come from. That's where the FDA is, the National Institutes of Health, where biomedical research happens. This is all at HHS. The president's budget, a leaked copy came out last week. We are expecting it also in early to mid-May. And the leaked copy had a lot of fairly drastic cuts, especially to programs that we care about. We know that the staff at the Office of Organ Procurement and Transplantation Network most of that staff has been let go. There's a program called Kidney X that is focused on innovative products in the kidney, especially kidney dialysis space. In the president's budget, they recommend getting rid of that program. Again, the budget is a proposal. It is not law. It often doesn't go anywhere, but it's an indication of where an administration's priorities are. So we're keeping an eye on that and to see what will happen. There will be hearings every time the administration, whatever the administration is, whenever they release a budget, there are always hearings on Capitol Hill in the House and the Senate to talk about what's in the budget and sort of the justification for some of the changes. So that will also probably be happening in May and June. So I think those are the highlights of what is happening. I'm happy to take questions, but also happy just to turn it over to Ben.
I just want to say it's just a handful, an earful.
Yeah, it's a lot.
It's scary.
Mm-hmm.
Yeah.
Well, we are working, and a lot of other patient groups, not obviously just us, but patient groups across the healthcare spectrum are working really hard to educate members of Congress about Medicaid. We understand that the Senate, and again, the Senate, whatever the House does, the Senate does also have to approve. There's not much interest in the Senate in cutting Medicaid. So there is hopefully that backstop. But I just wanted people to know kind of what's happening. Well, thank you, everybody. I really
got a
appreciate it.
question, Holly.
Oh, sure. Yeah.
What would be an alternative just in case, Medicaid is cut? What would be an alternative for kidney patients as far as a program?
Well, I mean, most people on dialysis already are covered by Medicare. And so those basic, dialysis is covered, doctor visits, hospital visits, et cetera, sort of basic healthcare needs are covered by Medicare. Where Medicare falls short and where Medicaid can fill in if you're eligible for Medicaid is that Medicaid can help pay your premiums and your out-of-pocket costs in Medicare, which I'm sure all of you know, there's no limits to the out-of-pocket costs in Medicare. So there is that basic coverage. So most people wouldn't be left without, would not find themselves with no coverage, but they'd find themselves with coverage that would still be expensive if they have to pay all the out-of-pocket costs. But alternatives to Medicaid, there really aren't any, unless you're on dialysis and are eligible for. We have premium. We pay health insurance premiums for people on dialysis who qualify financially, but Medicaid is really the safety net, and if it gets weakened, there's really nothing underneath it to catch people. And I don't mean to be so bleak, but that's unfortunately the reality of the situation.
Holly, one more question. How
Sure.
can we prepare just in case, it's cut? How can we prepare as patients?
I think one thing you can do is to tell patients to contact their members of Congress, that this is serious, and we're people that our day-to-day lives will be directly impacted. People that are on Medicaid will be directly impacted by these changes, and it's not possible to make big cuts to Medicaid and not have people feel the impact of it. And I guess, see if you can find a Medigap plan that maybe is affordable. So we're just hoping that this doesn't actually happen. And we're doing more than hoping. I mean, we're working very hard to ensure that it doesn't, along with a lot of other groups. And I'm not trying to be alarmist, but I think, now really is a good time to reach out to your members of Congress and senators and let them know that this is a really, really, really bad idea.
You mentioned, of course, we were talking about Medicaid and the potential terrible cuts that can happen. You also mentioned about the leaked, about the organ procurement organizations. In what way would that budget be cut, or if you know anything about it, like in what way can it be?
So the thing that I know, and I say no, but because there's not a lot of transparency, but a lot of people have lost their jobs at HHS and other departments across the government, but that's the one that we're most familiar with. But we know that it's the office, it's in the Health Services and Resources Administration, are there to do the modernization of the organ procurement networks to make sure that more organs that are available are actually used and that there's more equitable, distribution geographically. And many of the people working on that have already been let go from their jobs.
Right.
Gotcha.
So,
Well,
that's we know.
will TEFRA step up for Medicaid, or is that part of Medicaid?
I'm sorry, TEFRA?
Yeah.
I don't know what TEFRA is, but I can look it up.
TEFRA is a federal grant program that state that works as insurance, but states select if they want to take it or use it. And
Okay.
oh,
I see. It's a Katie Beckett. Is that the children with disabilities? Is that
that's how they use it in Arkansas.
okay?
But at one point, now this was a long time ago, but at one point it was not just for children, it was for everyone in Arkansas.
Okay.
And I guess they fixed it now to where it goes to children.
Well, I am looking at at least I Googled it.
Right.
It looks, if it is part of Medicaid, then it could be affected if there are these big cuts.
Right. Well, it's part of the Medicaid system, or if it or if it was their own system, you know. And so I guess I can make phone calls or emails.
Yeah. I mean, the thing about Medicaid is that each state has a lot of leeway to do
Mhm.
things that they want to do within their Medicaid program. However, again, at least half of the funding for Medicaid, and in some states it's way more than half. Some states it's 70 or 80% of the funding comes from the federal government.
Okay.
So it could be an Arkansas only program, but it still gets a lot of federal funding if it's associated with the Medicaid
Right. Okay.
program.
Okay.
Bobby, I am having a very hard time hearing you. And I know Karen, I see your hand is up, so we'll go to you next.
Holly, thank you for that update. It was very comprehensive and point on. One of the things that I would like to say is I think it was T. Walker that posed the question what other options we have if those cuts occur in Medicaid. To be honest, there really is no other safety net besides Medicaid, because there's billions of dollars that goes into Medicaid. We also have to consider that Medicaid is often known as services from birth to death. So if there are cuts and the funds go to the state, they will have to determine how the decreased funding will be allocated, because Medicaid goes to children, women, elders, people who are in senior homes. So it's incumbent on each of us to contact our legislators. We have to mobilize, we have to advocate, and we must share our voice that this will be devastating to those impacted by kidney disease.
Yeah, absolutely. Yes, thank you. That's completely true. And again, I think that we heard Deb Darcy, some of you may know Deb, she's also on our team, but she's been doing a lot of these meetings, and she said that the feedback we're getting from other patient groups and some congressional staff is that in the past couple of months, there's been all these meetings, all these patient groups going up to the Hill, and that it's had an impact. And so people's voices together have an impact.
Right.
I truly believe that.
Thank you.
Thank you. And Bobby, I'm sorry, I didn't mean to cut you off. I couldn't hear your question. And I know Eric, you have your hand up too.
Can you hear me now?
Not really.
It's still messed up, Bobby.
Sounds like you're underwater.
You could put your question in the chat if you.
I will.
Okay.
Hey, Holly, I just had a question about the dual eligibles. Because that second part is paid for by Medicaid, and it covers the insurance portion, well, the missing insurance portion, excuse me. How would that possibly be affected if they cut Medicaid programming?
So it would be affected by the cuts. It's part of, like, if you're what they call dually eligible, like I said, you're eligible for Medicare and Medicaid. And so you're eligible for all the benefits. You're just your Medicaid eligibility is just regular Medicaid. It's not necessarily a special category of Medicaid. And so if there are cuts to Medicaid that affect anyone in Medicaid, it would affect people who are dually eligible. I don't know if that answer makes sense, but any cuts that come to Medicaid would also have an impact on people who are dually eligible. And Crystal, see your hand is up.
Yeah, I was gonna also address the question that asked what other options there are. I know for Pennsylvania, Maryland, and Delaware, there's the kidney disease program, but it only covers the 20%. Medicare doesn't cover for just kidney related issues.
Okay.
But that program is in Delaware and Pennsylvania as well as Maryland.
Okay, well, that's very helpful to know. Thank you. There might be other states that have similar programs. So thank you, Crystal. I see Bobby's question. So Bobby's question is basically about the organ procurement and transplantation network, which is part of the federal government, this particular office. Well, if the government decides to eliminate the funding, then that would be the end of the modernization. I don't, the budget that the president is going to put forward has no, it's a proposal. It's not, they don't have the wherewithal to make all of it happen. However, and again, I'm not trying to be all doom and gloom here, but we've seen this administration has made changes that we didn't think were possible without legislation or without congressional oversight. And they've gone ahead and made changes that, again, they may or may not have the legal authority to do, but they're doing it. And so it could be that what the modernization that they were planning to do, I mean, OPT, it's not going to go away, but the modernization that they're planning could end. But there'll still be an organ procurement and transplantation network. I mean, that will still happen. It's just the modernization of it could stop. We don't know for sure, but they've certainly gotten rid of a lot of staff at the federal level who work on those issues. But again, yeah, I didn't mean to be alarmist. There will still be organ procurement, but just not modernized and improved the way it was suggested to the previous, when the first Trump administration in 2019 did an executive order on kidney health and modernizing and transforming the organ procurement network was essential part of that. And what was suggested in that executive order, which is in process, could stop. Any other questions? Well, thank you, everyone. And I'm always, we're always available to answer questions and, let you know what's going on. So I think, well, next month we'll have a little more information about what exactly the House is planning to do and maybe have more information about what the Senate has done and kind of where we are with these Medicaid cuts. And perhaps at that point, we'll probably also have a budget from the president, which again, I just want to emphasize is not law. It's just basically it's an outline of their policy interests and where they want to head. So it's an indication of what they're interested in doing, but it's not law. So
I'm sorry, I just had one question. Did the group go to Washington, D.C. yet?
No. So actually the group is coming on May 6th and 7th. And so actually the day that the committee in the House is considering these Medicaid cuts is the day we're going to be up on the Hill. So it's good timing on our part because we are going to talk about Medicaid.
Also, for those of us who are not able to go to Capitol Hill, if we needed to reach out to our elected official, we can reach out to, is that Ben and Eric?
Yes.
Yeah,
And they can go ahead, Ben.
No, so we have the action alerts on the website, but I guess this is a good transition into what I was going to talk about here. And that is want to talk about advocacy opportunities for everybody for the rest of the year. So number one, you can certainly, do the action alerts on the website that we have. And when the Living Donor Protection Act gets reintroduced, we'll have one for that as well. But since we're now in the warmer months, that is when we have more of the public events for members of Congress. So there'll be, like I always say, the parades, barbecues, things like that. And if you follow your elected officials on social media, or if you contact their offices and ask for, to be put on a distribution list, those are good ways to find out when they might be out in public, or if they are going to have any health fairs, senior fairs, veterans fairs, community-based educational things like that. It's a good way to just find out about those so you can be involved. But I'm still, trying to schedule the in-district meetings with the local staff of the members of Congress. We're taking a little break now because the Kidney Action Summit is just about like 2 weeks away. But we'll kick it back into high gear after that. So anybody who is on this call, and since you all had to register, I know your names. I would love to do an in-district meeting with you, with your members, if we haven't done it yet. In general, I'll let you know, the people who work in the district are sort of the helpers. They're the caseworkers, and so they're the ones who have experience working with the federal agencies. If people are having immigration issues, passport issues, Medicare issues, Social Security issues, stuff like that. They don't deal with the legislation. So in these in-district meetings, we don't really talk that much, if at all, about any bills. It's fine to talk about sort of the overarching issues like needing to protect Medicare and Medicaid, things like that. But the Hill folks are the ones who, we can scream at them about it. HB 1276, I just made that up, but those are the people we can talk to about the specific legislation. But why these in-districts are so important is it helps us build a relationship with these offices. And, if we have a good relationship with the office, sometimes they tell us like, oh, is there any legislation you wanted to talk about? I can just forward things to my colleagues in Capitol Hill. And then sometimes we'll do meetings with them, or when they send it to me, I send it to Holly and Deb to let them know. So it is sort of a tag team effort sometimes. But letting your member of Congress know about the issues that are important is obviously very important for us in the advocacy world. And it's also just an opportunity for everyone to be involved, because even if we might have done the in-district meeting for your member already, doesn't mean there can't be a Senate meeting that we haven't done. I don't think there's any state where we've done both senators and the House representative yet. So if you all are interested, please let me know. And if you're not interested, then you will get an email or a phone call or a text from me. So hopefully I can change your mind. But these meetings are pretty easy, only last about 10-15 minutes max. And we do them all virtually, unless you live close enough to me, and we can do them in person. And also, this is also when a bunch of holidays start coming up, and members tend to be out in the district a lot around Memorial Day. There's always parades and stuff. We've got July 4th, and just to prepare people for August, which is when Congress is in recess, and that's when members are back in their district for a lot of time. So just to put in everyone's mind that there's going to be lots of opportunities for people to do advocacy back in their area. So any questions about any of that so far? Okay. If not, then we can I'll stop the recording, and then we can do our Q&A time. So thanks everyone for joining for this portion so far.
Hey, Ben,
Yep.
just let